First of all, what is occupational therapy? Occupational therapy could be defined as the usage of different therapeutic methods to help the client regain, maintain, or develop their ADLs. ADLs are just a person's activities of daily living. This type of therapy typically involves the use of a person's occupations. Occupations in this context isn't per se a job or a type of employment, but these are activities that the person likes to engage in that they typically enjoy. Therapeutic relationships like that in OT and other methods of rehabilitation have been around for over 2,000 years, dating back to even the BC era, although the area of occupational therapy is fairly new. The arts and crafts movement of the early 1900s sparked many people like Herbert Hall, George Edward Barton, Dr. William Rush Dunton Jr., and Eleanor Clark Slagle to incorporate arts and crafts and other techniques into their rehabilitation programs. In the field, you can become either an OT or an OTA. The difference between the two is that the OT needs a little bit more schooling with either a master's degree or a PhD, and they're involved more with the professional side of the operation, whereas the OTA doesn't need as much schooling, and they typically are more involved with the technical side of the operation. There are many different settings that an OT can work within. Some of these include hospitals, inpatient or outpatient clinics, home-based agencies, day treatment facilities, schools, and other supervised living areas. Some of these settings can be specialized to certain populations, but others are more generalized and open to many different populations. The goal of occupational therapy services is to allow people to engage in occupations in their lives. In this field, there are many different roles as an OT or an OTA you may be asked to do in your professional career to enhance the progress of a client. Some of these may include a practitioner. The practitioner is the one who provides the OT services, and some of the duties include evaluation, intervention, and program planning. Another role could be an educator. You may be asked to teach and educate others on OT along with continuing your education. Another area might be a supervisor. The supervisor is in charge of managing all the overall daily operations of the facility. You also may be considered to be a consultant. A consultant provides the services to individuals, groups, or different organizations where it may not necessarily be in your particular setting, and you may even consider yourself an entrepreneur, where you could be partially or fully employed and offer OT services from home or at your own type of clinic. Occupational therapy takes on a client-centered approach where the client is the main point of focus. In this field, it is essential to get to know your clients and become aware of what their goals are for therapy. This also includes becoming aware of what occupations they have and how you can implement these into their rehabilitation plan. To obtain these desired goals, we as OTs use different intervention plan types. The first would be considered creating or promoting. This is used for those with or without disabilities to have those participating benefit by an enhanced performance. Another is called restoring, which is used to establish skills that have not been yet developed or to restore them if they have been lost. Another is considered maintaining, and this is used for a client to continue their occupation in the way that they are accustomed to and is to keep the client at their current level of performance. Modification, which could also be called adaptation or compensation, is also used to change the demands of the particular activity but still allows the person to participate in them. And the final type of intervention is called prevention. Prevention is used to help clients perform activities that may prevent disease or any other health concerns. And finally, there are many great benefits to becoming an occupational therapist. You as a therapist get to devise a plan of action for each individual person and be able to track their progress through that plan. A lot of the time, therapy sessions can be very frustrating for both you, the practitioner, and the client alike. As an OT, you'll learn a great deal of patience along with communication skills because some of your clients may have a hard time communicating with you the way that you and I may do. Some of the most rewarding moments come when that client reaches their goal and you can crack a smile knowing that your hard work helped them reach that goal. You will also develop great relationships with clients and their families, relationships that can last a very long time. As an OT, You will come to work every day loving what you do and knowing that your profession can have a great deal of effect on your life and those who you work with.